After 3 years of California's COVID-19 state of emergency, it will come to an end tonight at midnight. And while COVID-19 is much better than it has been in the past, it still remains among us.
Tonight, Front 4's Dan Kerman talks to experts about what the declaration did and how things may be going forward.
It is in the sum total of our individual decisions that we will determine the fate of this virus. We will meet or not meet the moment. I have confidence we'll meet the moment.
Governor Newsom made those comments in March of 2020, just days after declaring a COVID-19 state of emergency.
I have been, and I am now, so grateful that California did that. We were the first state in the country to do that.
UC Berkeley infectious disease specialist Dr. John Schwartzberg says he believes the measures that went along with that made a huge difference, and he points to the fact that California has the lowest death rate amongst the large states.
It's not to say that losing over 100,000 Californians in 3 years has not been just a terrible tragedy, but it could have been a lot worse if it wasn't for the state of emergency.
Now, 3 years later, that emergency proclamation is ending. Most mass vaccination and testing sites have already closed. And while vaccines and tests and drug therapies will remain free for now, come November, insurance companies may not cover some of those costs.
Where we're going to see a big problem is with the underserved. People who don't have the financial means to really have any kind of perturbation in their financial status, and having to pay for certain things may be a major problem for them.
And while life has returned to normal for many, COVID-19 has not gone away. There remains an average of 300 COVID deaths a day in the U.S. and the fear of contracting long COVID.
The responsibility is on us to protect ourselves. The government's not going to have all these guardrails for us that the government had before. And so we have to pay attention to that, and we have to act accordingly.
Schwartzberg says that means continuing to wear a well-fitting N95 or KN95 mask when indoors, especially if you're at high risk for a bad outcome. He also says it's important to stay up to date on the vaccine.
While they don't offer the kind of protection we'd really like for preventing you from getting infected or getting mild to moderate disease, they really work well in preventing you from being hospitalized and dying. And they do protect somewhat against getting long COVID.
Dan Kerman, Cron 4 News.